Welcome to the training for the new Equity and Health Inequalities and Quality Impact Assessment Form, EQIA. If your proposal impacts people, you need to complete an EQIA. Page 1 outlines there are 4 parts you will need to complete. Let's look at Part A, Section 1, Outline of the Proposal.
The outline is important because it gives a clear summary of what you're proposing, helping others quickly understand the purpose, scope, and potential impact on people before they read the full assessment. In this section, you need to indicate whether the proposal is a new service, a change to existing service, a redesign, or a temporary measure. In this section, please provide a brief outline of what is being proposed.
Thank you, Katie. That is the end of Part A, Section 1, Outline of the Proposal. We now move to Part A, Section 2.
This section asks you to check whether the proposal links to anything already recorded on the risk register, or whether it creates a new risk that should be added. You then need to note the relevant risk number if it exists, or briefly describe the new risk if it doesn't.
Thank you. That is the end of Part A, Section 2. Next is the Equality and Health Inequalities Impact Assessment part of the template, Part B, Section 1.
This is where you start to assess impact, starting with what health inequalities might emerge from your proposal. It's important to describe who your proposal impacts and include evidence to support your understanding of how they might be affected. We know that health inequalities are systematic, unfair and avoidable differences in health and well-being between different groups of people. Some people may face barriers, for example, because of a communication need, or be digitally excluded, or live in a deprived area. People share a protected characteristic may be impacted differently, for example, due to how we age, because of a disability, or sensory loss.
Thank you. That's the end of Part B, Section 1. We now move to Part B, Section 2.
This is where you describe if your proposal has a positive or negative impact on any of the protected characteristic groups, or whether relevant groups who might face health inequalities. Start with the positive impact. Pick which group is impacted and describe the benefits of your proposal. Next, tick which groups might be negatively impacted and describe how in the box below. Remember intersectional impact.
Sorry, Katie. Can you just explain intersectional impact for me, please?
Of course, intersectionality is a unique, compounded form of discrimination a person may experience when 2 or more of these characteristics overlap. It's important because it creates a distinct experience that is more than the sum of its parts. For example, a South Asian non-binary teenager referred to a community mental health outreach team. They face cultural stigma around mental health leading to reluctance to seek help, misgendering by staff resulting in reduced trust and openness, fear of racism so they avoid fully disclosing symptoms. Combined impact, they withdraw from sessions with high risk of deterioration. Their experience is shaped by intersections of ethnicity, gender identity, age. These factors combined not just add up to create unique barriers to accessing health care. Intersectionality helps us understand that people have complex identities, complex experiences of inequality. This is important to consider and may need specific actions to address. Continue to add evidence here to support your thinking. Or your proposal might not have a positive or negative impact. It might be neutral. State here if not applicable.
That makes sense. Thank you, Katie. That's the end of Part B, Section 2. We now move to Part B, Section 3.
This is where you share more detail around the negative impacts you identified further up. This is important so you can consider how you might level the playing field for all people. Name the affected group, describe the negative impact and add in what you're going to do to reduce or eliminate the negative impact.
Thank you. That is the end of Part B, Section 3. Let's have a look at Part B, Section 4.
This is your action plan. You're not adding anything new here. This is where you describe all the actions you're going to take to mitigate the negative impact you already identified above. Say how and when you will review the action plan. This is important for continued monitoring. It will help you to understand how successful your action plan is and any changes you need to make once the proposal is live.
Okay, let's move to Part B, Section 5.
This is your summary. This is where you summarise the main conclusions of the Equality and Health Inequalities Impact Assessment. This is important to explain how the EHIA has informed, influenced or changed your proposal.
Thank you. That's Part B, Section 5. Let's have a look at Part B, Section 6.
This is where you outline how the proposal will support our public sector equality duty. Our public duty has 3 aims: to eliminate discrimination, harassment and victimisation, to address equality of opportunity between people who share a protected characteristic and those who do not, to foster good relations between people who share a protected characteristic and those who do not. It's really important that you can share specific examples here for each of the 3 aims so that we evidence our due regard to each aim. This can also support any potential legal challenge if needed.
So why is it important to include evidence in the assessments?
Yeah, good question, Steph. It's essential to include evidence because it ensures decisions are based on real need, not assumptions or guesses. Helps identify who is most affected and why. Strengthens the justification for actions or mitigations, making them more targeted and effective. Demonstrates due regard to our public sector equality duty by showing how impacts were identified and considered. This can also support any potential challenge if needed. Ultimately, it supports data-driven and confident decision-making that delivers fair and accessible services and policies.
Thank you. That is Part B, Section 6. We now move to Part B, Section 7.
This is where you select your recommended course of action. Take into account what you wrote in the summary section in Part B, Section 5. You can see there are 4 outcomes. Outcomes 1 and 2 mean you believe you can go ahead with the proposal, taking steps where needed to mitigate any negative impact. If you assess as outcome 3, continue with caution as you need to justify why you would go ahead if there are clear risks to certain groups, even with mitigations in place. If you assess the outcome as 4, you need to stop and rethink your approach because the adverse effects can't be resolved or mitigated against. Assessing the outcome is important. It informs exec colleagues' thinking and their final decision making around whether to go ahead with the proposal.
Thank you. That's Part B, Section 7 completed. That concludes the end of the EHIA session of the impact assessment. You will also need to complete the quality impact part of the assessment. Once this is completed, please email to sirona.eqia@nhs.net for review and scheduling with the panel. Remember to allow enough time in your plan for review to be carried out by the EQIA team and for any panel steps before implementation.
Thank you, Steph. That's it. You now have a step-by-step method to complete your Equality and Health Inequalities Impact Assessment. Thank you for watching.
Thank you.